Ever wondered how doctors remove fluid that builds up around the lungs? There's a simple but important procedure for this called thoracentesis. First, the patient usually sits upright, leaning slightly forward, and rests their arms on a table for support. Next, the doctor carefully cleans and disinfects the skin on the patient's back. Then, they give a numbing shot to this area so the patient won't feel any pain during the procedure. Once the area is numb, the doctor feels along the ribs to find the safest spot for the needle insertion. After finding the right spot, the doctor gently inserts a thin, hollow needle between the ribs, all the way into the chest cavity, the area where the excess fluid has collected. The doctor carefully guides the needle to make sure it doesn't touch the lungs themselves. Then, the excess fluid is slowly drained out through a tube attached to the needle. After the fluid is drained, the patient's symptoms usually relieve quickly. Issues like shortness of breath and chest tightness will ease. You can even watch the collection container fill up with fluid gradually. This is the fluid that was pressing on the lungs and making breathing difficult. Finally, the needle is removed, and a small bandage is placed over the insertion site. The entire procedure typically takes less than 30 minutes to complete. Got any questions about thoracentesis?